Diabetes remains a vigilant challenge even under the cover of night. In fact, the night hours can reveal a distinct set of symptoms that every diabetic must be aware of. Recognizing these signs is crucial for timely management and uninterrupted sleep. Let's explore the 7 critical signs that should not be overlooked when darkness comes, because diabetes doesn't take vacations. The first nocturnal sign of diabetes is frequent thirst at night. Frequent thirst at night is a telltale sign for many diabetics, especially when blood sugar levels are high. High concentrations of glucose in the bloodstream remove water from the cells, causing the kidneys to produce more urine to eliminate excess sugar. This cycle results in increased thirst and frequent mixing even at night, potentially interrupting sleep. Effective management of this symptom is intertwined with overall diabetes control. Maintaining blood sugar levels under control is essential. Monitor glucose levels and adjust medication or insulin dosage as necessary under the supervision of a healthcare professional is essential. Hydration is crucial, but to reduce nighttime interruptions, try to balance your fluid intake throughout the day instead of consuming large amounts at once. In addition, reducing caffeine and alcohol can help, as both can act as diuretics, increasing urine production. Recognizing and addressing nighttime thirst is vital, as it is not just a sign of high blood sugar, but it can also be a restorative sleep disruptor. The second nocturnal sign of diabetes, nocturia. Nocturia is a term that may not be widely known, but its effects are palpably disruptive, especially for those with diabetes. It means an increased frequency of mixing at night, and high sugar levels in the blood often lead to this condition as the body tries to expel excess glucose through the urine. Consistently waking up during the night to go to the bathroom not only interrupts the sleep cycle, leading to fatigue and reduced of the urine alert, but also serves as a significant indicator that the blood sugar level is not within the ideal range for those seeking to manage this nighttime signal. 2 key strategies can be considered: regularly and consistently monitor blood sugar levels, and be aware of fluid intake at night. However, if the problem persists, it is crucial to consult a healthcare professional, as other factors may be contributing to nocturia. The third sign, sweating. Night sweats often manifest as excessive sweating during sleep, even if the room temperature is cold. In the context of diabetes, these intense sweats can serve as a warning for nocturnal hypoglycemia or low blood sugar levels at night. Several triggers, everything from certain medications and intensive insulin treatments to an imbalance in daily meals or vigorous exercise at night. Waking up drenched not only interrupts a good night's rest, but also indicates that the body's glucose has decreased too. Worrying levels. To manage night sweats effectively, it is crucial to consistently monitor blood sugar, especially at night. Recognizing and adjusting possible triggers, also under the guidance of a healthcare professional. Medication dosages may need to be reviewed as a precaution. Having a readily accessible source of glucose, such as glucose tablets or juice at the bedside, can be life-saving during nocturnal glycemic declines. The fourth sign, nocturnal hypoglycemia. Nocturnal hypoglycemia refers to low blood sugar levels that occur during sleep. For diabetics, it is a critical concern, as it may go unnoticed, leading to potential complications. Symptoms may include night sweats, vivid dreams, waking up with headache, and prolonged periods of hypoglycemia can result in seizures or even loss of consciousness. Managing nocturnal hypoglycemia is vital to the well-being of diabetics. Regularly monitor blood sugar, especially before bed. It is essential if levels are low. Consuming a snack rich in carbohydrates can prevent a nighttime slump. Adjusting the timing or dosage of insulin or other diabetes medications under medical advice. It may also be necessary to quickly combat low nighttime levels. It is advisable to have a fast-acting source of glucose, such as glucose gel or tablets, within reach of the bed. Educate friends or family about the signs of severe hypoglycemia and how to administer glucose injections or emergency glucagon can also save lives. The fifth sign, restless legs syndrome. As we explore this topic, I ask you to subscribe to this channel if you are finding this video helpful. Thank you. Restless legs syndrome is a neurological condition characterized by an uncontrollable desire to move the legs, often accompanied by tingling, itching, or crawling sensations. This discomfort can intensify during periods of inactivity, becoming particularly problematic at night for diabetics. A connection is noted between the prevalence of this syndrome and peripheral neuropathy, a common complication of chronically high blood sugar levels. Managing restless legs syndrome in the context of diabetes involves a multifaceted approach. Firstly, maintaining ideal blood sugar levels can potentially reduce the onset of neuropathy and thus restless legs syndrome. Additionally, Certain lifestyle changes such as reducing caffeine and alcohol consumption can alleviate symptoms of this syndrome. Regular moderate exercise has been shown to be helpful, but excessively strenuous activities can worsen symptoms. For some, leg massages, applying hot or cold compresses, or even practicing relaxation techniques. How meditation can provide relief. Sixth, nocturnal sign of diabetes: sleep apnea. Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breaths during sleep. Sleep leading to frequent awakenings is particularly concerning for diabetics, as disrupted sleep and reduced oxygen levels can contribute to insulin resistance and poor blood sugar control. And sleep apnea can also increase the risk of developing other health conditions such as high blood pressure, heart disease, and strokes. Sleep apnea itself is often related to obesity, which is a risk factor for type 2 diabetes. Excess weight can lead to accumulation of fatty tissue in the neck region, which can compress the airway during sleep, resulting in obstruction and episodes of apnea. Management of sleep apnea usually involves a condition of changes in airway style and medical interventions, in addition to weight loss, which can significantly reduce the severity of symptoms. Other measures include avoiding the consumption of alcohol and sedatives before bed, as these substances can relax the muscles in the airways, contributing to obstruction. Treatment with CPAP machines. Continuous positive airway pressure is a common approach to keeping the airway open during sleep. These devices provide continuous air pressure through a face mask, thus preventing airway collapse. Sleeping on your side instead of your back is also recommended to help prevent airway blockage. The use of positioning devices such as special pillows designed to keep the head and neck aligned can help in this regard, given the interconnection between sleep apnea and diabetes. Effective management is essential to improve not only blood sugar levels, but also overall quality of life, and reduce the risk of health-related complications. The seventh night sign of diabetes is nocturnal cramps. Nocturnal cramps, characterized by muscle contractions, sudden and painful cramps, predominantly in the legs, can be distressing for diabetics. These cramps can arise due to high or low blood sugar levels, reduced circulation, or diabetic neuropathy, a nervous disorder resulting from prolonged blood sugar levels. To manage and reduce the occurrence of nighttime cramps, keeping blood sugar levels stable is the critical first step. Regular monitoring and adherence to prescribed medication regimens can help maintain glucose under control. Additionally, gentle stretching exercises before bed, especially for the calf muscles, can relieve tension and reduce the risk of cramps. Stay hydrated and ensure an adequate intake. Balanced minerals such as magnesium and potassium can also play a preventive role. The use of footwear and support can also help. Warm baths or the use of heating pads can provide relief from cramps. If night cramps persist or intensify, it is essential to consult a professional health professionals to explore underlying causes and receive appropriate treatment recommendations. Recognizing the signs is your first line of defense in effectively managing diabetes. It not only improves sleep quality, but also strengthens the general management of diabetes. For more information about health and longevity, you can also find additional interesting videos appearing on your screen right now. Feel free to click on any of them, or better yet, watch both to continue your journey of knowledge with us. If you want to stay informed about health and well-being, subscribe to our Health and Longevity channel and turn on the notification bell to stay updated with our latest content.